My name is Boyu Hu from Huntsman Cancer Institute in University of Utah in Salt Lake City. Early relapse for lymphomas have different definitions for different lymphomas. So in terms of the most common aggressive B-cell lymphoma, which is diffuse large B-cell lymphoma, early relapsing DLBCL patients are considered either primary refractory, in which they have inadequate response to frontline chemoimmunotherapy, or they have progression while receiving frontline therapy. And the second definition for them would be if they relapse within 12 months of initial chemoimmunotherapy. These early relapsers most likely show chemo resistance, and therefore our conventional second-line therapies for these patients were a salvage chemotherapy followed by autologous stem cell transplant. However, multiple clinical trials have now shown that for these early relapsing patients that relapse within 12 months, that CAR T cells, or chimeric antigen receptor T cells, especially with axi-cell and lyso-cell, improve outcomes for these patients as compared to conventional chemo followed by auto transplant. And so we have been moving these patients earlier and earlier to receiving CAR T cells, as this is a novel mechanism. It can potentially be curative, and now has been shown to be more effective than conventional chemotherapy. In terms of indolent lymphomas and follicular lymphoma, which is the most common type of indolent lymphoma, we consider patients that have progression of disease within 24 months of frontline chemoimmunotherapy. These POD24 patients have worse prognoses than patients that progress after 24 months. And so we've been trying to move these patients onto more aggressive therapies, including potentially salvage chemotherapy followed by autologous stem cell transplant if they're eligible for it, but more so to more targeted therapies, novel therapies, including CAR T cells as well. CAR T cells have been shown to be both very effective and also mostly safe in this population. And so these are novel treatment strategies that can be used. Furthermore, I think that there's also going to be bispecific antibodies that will become more readily available in the near future that will also add another treatment option for these more aggressive behaving follicular lymphoma, indolent lymphoma patients.